Low stomach acid. Symptoms, causes, and treatment. Low stomach acid symptoms. How to recognize hypochloremia. Insufficient stomach acid is accompanied by one or more of the following symptoms: flatulence and belching immediately after eating, feeling fullness and heaviness after eating and heartburn, indigestion, diarrhea, or constipation, multiple food allergies, itching in the rectal area, dilated capillaries on your cheeks and nose, acne, eczema, and rosacea, huge belly after eating and stomach sounds. Low stomach acid causes. Stomach acid is essential for digestion, although most of its components are later reabsorbed in the intestines. The stomach gradually loses its ability to produce hydrochloric acid, HCl, around the age of 35. About 75% of people over 50 do not produce enough HCl. And without it, food containing protein cannot be digested well. When the stomach does not produce enough HCl, intestinal bacteria and fungi, Candida albicans, get in and ferment food that contains a lot of carbohydrates, juice, fruit, bread, etc. Constant low production of HCl leads to vitamin B12, calcium, and protein deficiencies. New food allergies may also appear as large undigested food fragments pass through the gastrointestinal tract. Belly noises after eating or stomach bloating and even anemia may occur. Low stomach acid treatment. Drink lemon juice diluted in water, or undiluted, at the beginning of each meal. Take English bitter herbs, yellow bitter root, Gentiana lutea, before every meal. These bitter herbs have helped people with digestion for centuries. Take betaine HCl, 75 to 250 mg, 15 minutes before each meal. Do not take antacids because they neutralize stomach acid and make the problem worse. In addition, most of them contain aluminum and other harmful additives such as calcium carbonate, which will cause the production of HCl to be more than normal. Magnesium compounds cause diarrhea, sodium bicarbonate flatulence, and flatulence. Chewing gum stimulates acid secretion and weakens the stomach. Drinking liquids with meals dilutes gastric juices. Yellow bitter root and yarrow increase the secretion of gastric juice due to their bitterness.